Why are different oral antibiotics prescribed for diverticulitis? Imagine your gut as a bustling city, filled with many different bacteria working together. Sometimes, small pouches called diverticula form in the colon wall, and if these become inflamed or infected, it's called diverticulitis. To treat this, doctors often prescribe different oral antibiotics. But why so many options? It all comes down to targeting the right bacteria, matching the infection's severity, and considering each patient's unique health situation. Diverticulitis is mainly caused by bacteria that normally live in your gut. These include gram-negative bacteria like Escherichia, coli, and anaerobic bacteria such as Bacteroides species. Because these bacteria can vary in how they respond to antibiotics, doctors need to choose medications that effectively cover both types. For example, a common outpatient treatment combines ciprofloxacin, which targets gram-negative bacteria, with metronidazole, which is effective against anaerobic bacteria. This combination ensures broad coverage of the bacteria most likely involved in diverticulitis. The severity of the infection also influences antibiotic choice. Mild cases that are managed outside the hospital might only need oral antibiotics, often for about 10 to 14 days. But if the infection is more serious or complicated, initial treatment might involve intravenous antibiotics in the hospital, followed by oral medications once the patient improves and can eat normally. The goal is to control the infection quickly and prevent complications. Another important factor is antibiotic resistance. Over time, bacteria can become resistant to certain drugs, making some antibiotics less effective. For instance, resistance among anaerobic bacteria like Bacteroides fragilis has increased against drugs like clindamycin and cefotin. Similarly, community-acquired Escherichia coli may resist antibiotics like ampicillin sulbactam. When resistance patterns are high in a particular area, doctors may choose different antibiotics or confirm susceptibility before prescribing. Patients' individual health conditions also matter. Older adults, those with weakened immune systems, or people with other health issues may need broader coverage or different antibiotics. Sometimes, initial treatment involves intravenous antibiotics to ensure the infection is controlled, especially if the patient is severely ill or has other health risks. Recent research has also influenced how doctors approach treatment. Some studies suggest that antibiotics might not always be necessary for mild and complicated diverticulitis. In such cases, doctors may decide to watch and wait, avoiding antibiotics unless symptoms worsen. When antibiotics are used, the choice is tailored to the infection's severity, bacteria involved, and local resistance patterns. In summary, different oral antibiotics are prescribed for diverticulitis because each case is unique. The goal is to choose medications that effectively target the bacteria involved, considering how severe the infection is, what bacteria are resistant in the area, and the patient's overall health. Combining drugs like ciprofloxacin and metronidazole is common because they cover the main bacteria responsible. However, doctors always consider individual factors and evolving guidelines to ensure the best care. If you suspect diverticulitis or have concerns about your treatment, it's always best to consult a healthcare professional for personalized advice.